Hi, I'm Dr. Hope Hodgson-King. I'm a senior clinical psychologist in Hampshire CAMHS. Welcome to this workshop all about understanding and managing anxiety for children and young people. So today we're going to be thinking about what anxiety is. We're also going to be thinking about the signs and symptoms we commonly see for children and young people when they're experiencing anxiety. I'm then going to introduce you to a range of strategies and skills that you can use with your child to support them to help manage their anxiety. And at the end, I'll also introduce you to a range of resources that you can use to kind of build on the things that we've talked about today. I recognise that those watching might have a range of experience when they're thinking about anxiety. So some of you might already have a lot of knowledge yourselves, some might have very little knowledge. So I'm hoping that this workshop will meet all of your needs. I'm very aware that a lot of you might be watching this workshop because you have a child or young person who's experiencing significant anxiety at the moment. Just a bit of a health warning, please look after yourselves. When we talk about anxiety, we can often start to feel quite anxious. That's completely normal. I'm going to be thinking a bit about why that is today, but do look after yourselves and visit our Hampshire CAMHS website if you want any more support for yourselves too. What is anxiety? As you can see, there are lots of different words to describe anxiety. Feelings of worry, unease, terror, fear, butterflies, tension, frustration and anger. The dictionary defines anxiety as a feeling of worry, unease or nervousness that results from a situation with an uncertain outcome. But when we're thinking about anxiety today, all these words apply. We also recognise that anxiety is on a spectrum. So you can feel a little bit worried, but very much able to kind of get on with your day-to-day activities. Starting to feel kind of quite worried, anxious, it's starting to impact your thinking, and you're starting to notice that it's impact what you're doing in your day. And then at the other end of the spectrum, you can start to feel really overwhelmed, panicky. It's really hard to think and concentrate, and you're unable to get on with the things that you need to do in that moment. So we recognise anxiety is on that spectrum, but when we're thinking about anxiety today, all the signs and symptoms and the skills that we're thinking about apply to all parts of that scale. So why do we get anxious? I'm going to start by saying something that might surprise you. In general, I believe anxiety is a really good thing. So anxiety is our inbuilt mechanism that allows us to pick up danger in order to keep us safe. Lots of us want to be safe, which means we're really good at picking up danger, and it means that it's really normal. So like all mammals, our bodies have evolved over thousands of years to always be alert for potential threat. Anxiety can also be really helpful because it helps us communicate danger really quickly to one another. So if there was something unsafe in this room, my body would probably show it quite quickly. And if you were in this room with me, you'd probably turn to look at it without me even saying anything. So it's a really quick way of us very quickly communicating danger to keep ourselves safe. A little bit of anxiety also motivates us to act. So if we're feeling slightly anxious about a test or an interview, we're more likely to prepare and plan, which can ultimately help us to do better. Anxiety also helps us to connect with one another. So if I was feeling quite anxious, you would probably start to feel a bit anxious too, and that would help you to respond a bit more appropriately to me, to support me in those moments. So a little bit of anxiety can also be really helpful to make us connect. So therefore, kind of anxiety has been bred with us kind of from childhood and birth all the way up to adulthood, and it's a really helpful adaptive survival mechanism to keep us safe. If you pause this video and type the web address into your browser, you can quickly watch a video which I think summarises some of the things we've been talking about in a bit more detail. I'll see you in a minute. I love this video because I think it really nicely shows how even from a very young age we all have this natural inbuilt anxiety response system to danger. You can see in the video that this child becomes very naturally scared by the caregiver, and even without communicating, it results in the caregiver comforting the child. So we can see how anxiety, even from young as a baby, helps the baby to communicate its needs and get support when it feels unsafe. So that's why we get anxious, but how do we get anxious? So our brains are amazing. This is the brain. In the front of our brain, we have something called the prefrontal cortex. That's our thinking part of our brain. This brain is linked to the brainstem, which links down to our central nervous system, down into our body. Now, in the centre of our brain, we have something called the amygdala. That is our anxiety response centre. So the amygdala is always on the lookout for picking up danger. And when it spots danger, it will send certain signals into the rest of the brain, so it starts to pump signals down to the central nervous system to pump out hormones into our body, which allows us to get ready to respond appropriately to danger. A really good way of thinking about this is to think about a caveman. So when we think about a caveman, thousands of years ago, a caveman often had to do a lot in order to survive. If a caveman saw a saber-toothed tiger, we would hope that his amygdala would notice that danger, signal danger into his brain to pump certain hormones into his body to get him ready to run. Food was quite scarce back there, and if he saw someone trying to steal his food, his amygdala would also send signals to his brain, pumping hormones through his body. But instead of preparing him to run, we would hope in that instance he would fight. Medicine wasn't the same back then. So the amygdala would also have a response system that if he got injured and he was having blood loss, he would drop to the floor really, really quickly. That was the amygdala's faint response. Sometimes as well, he couldn't outrun the saber-toothed tiger, but the saber-toothed tiger might not see him quick enough. So he would also have a freeze response. So the caveman had this fight, flight, faint and freeze response, which allowed him to keep himself safe. Now, we might not have the same dangers that the caveman did, but our brains have very cleverly adapted and evolved over the years in order to keep ourselves safe from day-to-day dangers. So just like the caveman, we have the same fight, flight, freeze and faint response. That means anxiety is normal and we will all experience it day to day. I think this is a really nice example that we often use with little children to help them understand this fight-flight response. So it's the idea that we have this little smoke alarm in our brain that will signal an alarm bell when we see danger, which allow us to respond. And just like a smoke alarm, although it often will pick up appropriate dangers and set an alarm off, sometimes it can be accidentally set off as well, either by vibrations or sprays, and in the same way our brain can sometimes get a bit confused about what is dangerous and what makes us anxious. It's important to remember though that social context is also really important when we're thinking about anxiety. So babies may respond to frightening noises that we saw in that video coming from parents, but they learn not to fear it. I'm sure when you watched that video, you didn't have the same response as that baby. And that's because our brains have evolved over time based on our social context to learn what to fear and not to fear. You'll notice that there's another web address in this video. If you pause the video and type this into your web browser, you can watch this video, which will show this in a bit more depth. See you in a minute. I really like this video because I think it really nicely shows how the baby has this natural innate anxiety fight-flight response to the noise of the caregiver. But when it sees the caregiver's response, it's able to notice that it's not something to be feared for. And so we're seeing throughout this video, this baby learning to hold that sense of fear and regulate that anxiety response a bit better. So what we see is through play and social interactions, babies learn how to hold those feelings of fear, and that really allows them to kind of discover, explore and expand their experiences and their abilities. It's important to recognise that developing brain is really important when we think about anxiety. So as you saw with that baby, they had a very quick fight-flight response. But as they got older, they start to be able to regulate that a bit more. So when children are really little, that fight-flight response will happen really, really quickly. So that thinking part of the brain will switch off to really focus on the amygdala. As children get older, we notice that they start to be able to regulate that fight-flight response. However, adolescence is a time where the brain is going through lots of different changes, and this can kind of make the brain a bit more sensitive to kind of anxiety responses. And that's why sometimes that we see, particularly in adolescence, we see an increase again in children's anxiety as they start to develop fears more related to kind of social and kind of cognitive worries. We call these kind of social anxiety or generalised anxiety. So just like a mobile phone, our bodies are constantly on the lookout and alert us to potential incoming threats and signals in order to protect us from danger. Children and young people's brains have really adapted to be on the lookout for day-to-day stresses and fears in their day-to-day life. So I'm going to ask you now to pause and have a bit of a think about the threats and triggers for your child or young person in their day-to-day life. You might want to write it down if that's useful, but take a few minutes and have a think, and I'll see you in a minute. So hopefully you had a bit of a chance to think about the triggers for your child or young person's life. Here are some of the triggers that children and young people often tell us will trigger their anxiety day to day. Social events such as parties, activities with their peers, football or sporting events, an upcoming performance such as exams, school plays or sports days, specific phobias that can range from anything from spiders to dogs to fear of heights, social media and the news as well is often a trigger that we hear at the moment, separating from a parent or going away or somewhere new situations in general or changes to routine, sensory overload and overstimulus of lots of different things in a child's environment, and actually triggers can be anything and everything. So often children will describe worrying about absolutely anything and everything around them. We also hear young people start to say worries, including kind of worries about themselves, and we call them I am statements. So I am stupid, I am a failure, and these become very significant worries in children's lives. When thinking about anxiety, it can be really helpful to break it down into 3 areas so we can really help to identify the signs associated with anxiety. And we do this by thinking about anxious thoughts, anxious physical sensations, and what we do when we're anxious. I'd like you to take a moment now to pause and think about the anxious thoughts your child might communicate when they're feeling anxious, how they might physically be feeling, and what you notice they do when they're anxious. Take a moment to think about this. You might want to write it down, and then I'll see you in a minute. Hopefully you've had a bit of time to think about what your child might feel and think and do when they're feeling anxious. Some of the thoughts we often notice children and young people say when they're feeling anxious include things such as I am statements. So, I'm stupid, I'm a failure, I can't do this, I cannot cope, I won't be able to cope. Anxious thoughts also take the form of what if worries. So often children will describe kind of very predictive thoughts about the future. What if I fail? What if I don't know the answer? What if they don't speak to me? What if they think I'm silly? We call these what if worries, and they're very common when someone feels worried. Children and young people also describe a range of physical sensations when they're feeling anxious. So one of the first ways that we know a little child is feeling anxious is they might communicate it by saying their tummy hurts. Butterflies in the tummy, but also feeling nauseous and your tummy aching is a really common sign with anxiety. Other physical sensations include breathing increasing, your heart rate increasing, feeling sweaty, feeling sick, feeling tense. The legs might shake, and some children report kind of pain in their shoulders or headaches due to kind of an increase in tension. Some children also describe needing to go to the toilet more, needing going to the toilet less, feeling more hungry or feeling less hungry, and feeling more fatigued as well. Some children also describe this feeling kind of over impending doom, which they describe as feeling very physical. Other physical sensations include kind of a choking sensation in their throat or feeling like they've got a really dry throat as well. Other sensations include feeling faint. Not all these physical sensations your child will experience all at the same time. Some might be more common than others. We're all very different, and so it's really important that we try to understand what are the physical sensations that a particular child is experiencing. Other signs of anxiety allow us to really think about what a child might do when they're feeling anxious, and it can be really helpful to look at them in the form of avoidance. So anxiety and avoidance often come hand in hand. So children might often either refuse to do something or just say they can't go to something. They might flee the situation, that's that flight response, leaving the classroom, leaving the football event, and they might just describe that they just need to go home. Other forms of avoidance take the form of distraction, so needing to listen to music to be able to get through an experience. Being on our phones for a long time has become a really good avoidance strategy when we feel anxious. and also seeking reassurance. So seeking reassurance from parents or caregivers or friends is a really good way of quickly bringing anxiety down, so it becomes a really common behaviour that we see children do. Another behaviour that's really common when someone is worrying is actually worrying itself becomes a behaviour. So children spend a lot of time practically engaging in worrying, and that becomes all-consuming and overwhelming. So it actually becomes something that a child is doing. So I started by saying that anxiety is a good thing, but I'm very mindful you might be watching this video because anxiety has become a real problem in your child's life. So when does anxiety become a problem? Anxiety becomes a problem when it keeps showing up and it starts to impact on day-to-day life for your child. So it might start to impact what they need to do, such as attending school, going to the shops, going to a family event. It also becomes a problem when it starts to impact a child doing what they want to do. So a child might say, I really want to go out with my friends, or I really want to go to this party, but I just can't. So why does anxiety keep showing up? The problem sticks around because the way that we think, the way that we feel, and what we do starts to maintain the original anxiety. Often I hear from parents and children, they say, well, we noticed anxiety started to impact in this part of life, and then we started to notice it was starting to impact this part of life, and it started to have this snowballing effect where it becomes bigger and bigger until it's really all-consuming. It's important to recognise we might not always know what caused anxiety. There are lots of different things that can contribute to why a child might be experiencing anxiety. Genetics and temperament might play a part. Sometimes parents describe that their child was always a worrier. There can also be specific life events that really clearly define kind of the increase in anxiety for a child. But it could also be a build-up of lots of things over time, or a combination of all these factors that interplay while your child is really struggling at the moment with anxiety. Although we might know the complete reason, we don't always need to know what caused it. The most important thing is that we understand what maintains anxiety. And that's what we're going to be thinking about now, by thinking about the links between our thoughts, feelings, and what we do when we're anxious. So I want to introduce you to the hot cross bun model of anxiety. The reason we call it this is it kind of looks like a hot cross bun. And this is based on cognitive behavioural therapy, CBT for short. CBT is NICE guideline approved, which means there's lots of research to show that it can be really helpful for supporting children, young people and adults who are experiencing anxiety and other mental health difficulties. CBT is the first line intervention for children and young people who are experiencing anxiety, and so that's what we're going to be thinking about today. So in this example, I want to introduce you to Jess. So in this situation, Jess didn't understand something in class, and she wanted to ask a question. Jess started to get the thoughts, everyone is looking at me. They will think I'm stupid. They all know the answer. I'm stupid. This made Jess start to feel anxious and sad, and she started to notice physical sensations. So her heart started to race, her breathing increased, she started to get a nervous stomach, and she started to feel clammy, have hot hands, and she started to feel like she was going red and hot. All these thoughts and feelings led to Jess doing certain things. She started to look down. She tried to be invisible, and she couldn't think straight, so she was not able to get on her work. Eventually, the anxiety got too much, and she felt she needed to escape, so she left the classroom. As you can see, that the next time Jess was in this situation, it increased those thoughts, and so you can start to see how this becomes a real cycle that starts to impact day to day. Now I want you to stop and think for a second. What do you think if Jess didn't have those thoughts? Everyone's looking at me, I'm stupid. What happens if she thought, maybe other people are confused too. Maybe they don't understand the answer. In that moment, Jess might not feel sad. She might feel a little bit anxious, but she might not feel as anxious. It might not lead to the same physical sensations, and ultimately it might not lead to her looking down and eventually leaving the classroom. So we can see how we think really impacts how we feel and ultimately impacts what we do. So the idea of CBT is about trying to break that cycle. It's about understanding the thoughts, feelings and behaviours that your child does when they feel anxious, how that maintains the anxiety, and thinking about alternative thought challenging, physical sensation management, and thinking about how children can respond differently to their anxiety in order to break the cycle. Hopefully that makes sense, but I'd really encourage you to take time with your child to really understand their own maintenance of anxiety cycles and the way that they think, what they feel and what they do, and how that keeps their anxiety going. This is the first skill I'm introducing you to. It can be really hard at first, but with time it can really help to then think about what strategies you need to use with your child. At the end of this workshop, I will link you to a range of resources with more details on this, which shows you lots of different ways that you could start to explore this with your child. So I'm now going to introduce you to a range of skills and strategies that you can use with your child in order to think about alternative thinking styles, how they can manage those physical sensations, and how they can change what they do when they feel anxious. It's really important to highlight that it's a bit of trial and error with your child to work out which of these skills work best for them and for you. Sometimes you have to be a little bit creative to make it work for your child. It's really important to say as well that it's really important to practice these skills when a child isn't anxious, so it's easy for them to use in those moments when they do feel anxious. I also want to highlight not to forget the things that you know already work with your child, because it's really important to continue to use those too. So the first skill I want to introduce you to is and firstly. And stands for aware, naming the body's message, and describing the feeling. So often when we feel anxious, it's really hard to even name and notice that we feel anxious because we want to avoid thinking about it. So the A for aware stands for really being aware of what's going on, being aware that you're feeling anxious and noticing those physical sensations in the body. Then it's about naming the body's message. So, I'm noticing I'm feeling anxious. I can feel it in my tummy. This is my body telling me that I'm feeling anxious and feeling unsafe. And then you get the child to describe the feeling. When I feel this, this makes me feel something. Anxious, fearful, worried, nervous. It's really all about helping a child to label how they're feeling and communicating that clearly. It may seem really simple, but it's the first step that's really important to allow a child to be able to notice how they're feeling and then use the additional skills to respond to that feeling of anxiety. So the next skill I want to introduce you to is about the doing part of the CBT cycle, and that's about testing things out little at a time. So as you can see on this graph, when we start to feel anxiety starts to go up. Anxiety starts to increase, and our brain will tell us that it's going to keep on going, it's never going to end, and that we won't be able to cope. When we start to have these thoughts, we start to do things really quickly to try and bring that anxiety down. That's quick ways of coping. But often those quick ways of coping involve avoidance. Avoidance can be really helpful because it drops anxiety really quickly. The problem with these coping strategies, although they're really quite quick and resourceful, it means that next time a child is in that situation and anxiety goes up, they have to use the same coping strategies to manage that anxiety. And we can see where that becomes a problem, because if avoidance is the coping strategy, it can start to have a real impact on day-to-day life. So now, if we don't use those quick coping strategies of avoidance, what do we think would happen? Well, anxiety would continue to go up. However, what we know about anxiety is because it's a safety mechanism, it always has to reach a plateau. And the research shows that actually anxiety will reach a plateau within 45 minutes. Now that doesn't mean it can't go back up and down again, and that's why some children will describe feeling anxious for days at a time. But we know 45 minutes is the max time that someone can stay at that peak anxiety before it starts to come down. Now if a child sits with their anxiety for that time without using those coping strategies and allowing it to come down, what we find is the next time they're in the same situation, anxiety will come up again, but it might not come up so high. And what we find is it might come down quicker. And the more times they repeat that same situation, sitting with those anxiety, we find anxiety starts to keep coming down. And that's the idea of this strategy of testing things out little at a time. Now, we're not asking you to go home and put your child in the most anxiety-provoking situation that they can be in. That would be too much and too hard. But what we can do is start to create a bit of a stepladder, testing out, asking a child to sit in a situation that feels a little bit scary, then moving up to situations that feel quite scary, and all the way up to feeling very scary. And what we find, by the time they reach the top of the ladder, their anxiety is a lot more manageable, and they're learning that they can cope, and anxiety will come down. So we call this a step ladder or an exposure ladder, and it's really all about creating a fear hierarchy. I'm going to show you an example about this in practice. So in this example, this child is afraid of snakes, and so what we've asked them to do is to rate their fear of snakes out of 10, and rate lots of different situations out of 10 where they might feel scared as a snake. And as you can see, they've rated all of these fears and situations out of 10 from the least scary situation to the most scary situation. So in this example, talking about snakes makes them feel a little bit anxious. Seeing pictures of snakes makes it a 5 out of 10. Watching movies, a 6 out of 10. And going to the pet store and holding a snake is a 10 out of 10 fear. So what we get this child to do is to start with the least scary situation, so talking about snakes, and to practice talking about snakes until the anxiety reduces by half. And then we get them to repeat that again and again until the situation becomes a lot less scary and more manageable. Once they've done that first step, they then move up to the next step. And they keep moving up the steps until they get to the top one of going to the pet store and holding the snake. And what we find by the time they get to the top of that ladder, holding a snake doesn't feel quite as scary. It still feels quite scary, but it's manageable. What you can see from this example is you might have rated your events slightly different to this child. That's okay. Everybody is different. And that's why it's really important when you develop a step ladder with your child. It's got to be their ladder, not yours, as they might rate it differently to you. You can make it really fun and creative, but it's really important to do each step in agreement, not surprise your child, and most importantly, doing it without distraction. That includes reassurance, and that can be really hard as a parent, but you can sit with them while they're facing that fear and really encourage them that they're doing really well to sit with that. When we talk about step ladders, parents will often ask, well, what happens if my child has lots of different worries and anxieties? That's okay. You can create multiple ladders. And actually we find it's really important to start with a ladder that feels manageable for a child and really focus on something that they really want to overcome. What we find as well, by starting with one ladder, it can actually help anxiety in lots of different areas. And we start to find that by a child noticing that they can cope when they feel anxious and anxiety comes down, starts to help them in lots of different situations. So what can you do to support your child when they're feeling anxious? Firstly, encouragement and praise is really, really important when we're asking a child to manage a difficult situation. It is far harder to go to school with anxiety than to go without. And although praise can feel uncomfortable for children, it's really important we're on the lookout for times when they're able to do things whilst feeling anxious. You can also use rewards for achievements, and it's really important at each step of your ladder to have a reward for your child to really enforce the positives of giving things a go, a bit like what we might do when we positively reinforce good behaviour with little children. Now, rewards don't have to be big things. It might not be a trip to Legoland or a new PlayStation. Actually, often what we find, what children want as a reward, is quality time. And that can look like choosing the evening meal or a bit of quality time in the evening with you to do something that they enjoy. It's really important to set these rewards before starting your ladder and giving them a go. Sometimes as well, you might find that you give a step on the ladder a go and it's too much for your child. That's absolutely fine. It just means that it's a step too high. So you might have to create a mini step in between that feels a bit more manageable before stepping up. Another thing that you can do to support your child is provide reflections to develop insight. So you might say, I wonder if you're feeling worried about that party next week. Now, sometimes parents worry about doing this because they worry that might put a worry in a child's mind. This isn't often the case, and children are quite good at telling us if that's not the case and they don't feel anxious about that. But sometimes it's really helpful for parents to start to label what they think it is to help children to develop that insight for themselves. Another really helpful skill can be for you as parents to model facing your fears and that positive have-a-go behaviour. You can do this by either labelling that you might feel a bit fearful about something if it's appropriate. Possibly you have a big meeting at work and you could acknowledge that you feel anxious about that, but that you're willing to give it a go. You might also have a specific fear that you can create your own ladder for as well, so you can model also working your way up the ladder to face your fears. Some families like to create ladders for all members of the family, so they're all working to a goal at the same time. You can also be on the lookout for have-a-go behaviour too, and be praising a child when you notice that they manage an anxiety-provoking situation well. Another skill that can be really useful is to normalise anxiety for them and remind them that it's just their brain responding to that fight-flight response in order to keep them safe. What's really important as well as a parent is to allow independence and encourage problem solving in order to help children develop skills to know that they can manage anxiety themselves and not rely on others. The next skill I want to introduce you to is around stress reduction, and this is about responding to the physical sensations that come with anxiety. Breathing is an amazing way that overrides the body's stress response and brings the rational thinking part of the brain back online, which can often go offline when we feel anxious. A good example of this in action is when you jump into water, in really cold water, you notice you take that big breath. That's just that body's central nervous system reaction. It's the same reaction that happens when we feel anxious. So breathing can actually bring that anxiety response centre back online. There are different breathing strategies that can be really useful. At the end, I'm going to introduce you to a range of resources that you can use to work out which breathing strategy might work for your child. Some children really like to focus on their breath, so focus on belly breathing or making a balloon in their belly can be really useful. Some children find that by focusing on their breath, they start to notice their breathing increasing more and more, and this can make them more anxious. And that's where other strategies, such as square breathing, when you focus on a square shape in the room and follow that around, breathing in for 4, holding for 4, breathing out for 4, and holding for 4 can be really useful. Other strategies include focusing on colour breathing. So imagining a calm colour and breathing it in, noticing how it fills the body, and then thinking of an anxious colour and imagine breathing that out. It's very much trial and error and working out what works for your child. Another physical sensation can be about focusing on the senses around us. And a really great strategy that children find often really useful is to focus on 5, 4, 3, 2, 1. So that's focusing on 5 things you can see in the room, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. And I always like to encourage 1 deep breath afterwards. It's a really useful strategy, and if your child has sensory needs, you can just take out the step that doesn't quite work for your child. Again, there are lots of websites and resources that can be really useful that give a range of physical sensation kind of skills and strategies that you can use in the moment to reduce those physical sensations quickly. Why not give them a go? The final strategy is around challenging anxious thoughts and having thinking strategies. Now, often we find older children a bit better at thought challenging. However, some young children can be really good at it too. The first step of thinking strategies is about being able to identify worry or anxious thoughts. Some children are really good at this and can really quickly tell you what they're worrying about. Other children, you might have to spend some time developing a bit of insight into this, and that's where the earlier strategies and the cycle of CBT comes in. Once the child's able to identify that worry, you can encourage the young person to question its accuracy. Often anxious thoughts can be really convincing. They come across as facts, but actually when we unpick them, they're often opinions. You can be really curious with your child and get them to question its accuracy. Is it fact or fiction? What's the evidence for and against that thought? You can put that thought on trial and think of the pros and cons for the evidence for that thought to work out a more balanced thought. Notice if your child says always or never as part of that thought. You can ask them, are there times when it hasn't happened? Again, all these examples is about creating alternative, more rational thoughts that feel less anxiety-provoking. A great question to ask a child is, what would they say to a friend with the same worry? Often children are really good and thoughtful at giving advice to their friends, and actually asking this question can help them to give an alternative, more rational advice to themselves. As I said before, the aim is about creating flexibility. Again, at the end, I'm going to introduce you to a far more range of resources that will go through this skill in more depth. I often get a lot of questions around neurodiversity and anxiety, as often children with neurodiversity can experience increased anxiety. The strategies I've talked to today can help children with neurodiversity. However, you might just need to make a few adaptations. However, I think that these top tips work for all children, and so I encourage you to think about how it applies to your child in their independent situation. So for any child or young person experiencing anxiety, we should firstly help them to understand how to label and identify thoughts, feelings and behaviours. Sometimes children with neurodiversity might just need a little more time with this stage to really understand and identify their thoughts and feelings. We should also always consider if there's anything in the environment contributing to anxiety that needs to be changed. CBT can be really useful, however, it's the environment causing the anxiety. It's really unfair to ask a child to find out alternative thinking strategies and change what they do if it's the environment contributing to the problem. We should also make adaptations to strategies to meet the individual's needs. You can be very creative with this, and it's really important as well to go at a child's pace. That might mean sometimes you might have to repeat stages a few more times with children with neurodiversity. And what's most important with all children is when thinking about anxiety, it can always really knock a child's confidence. And that's why it's really important that we're really focusing on children's strengths, their interests, their goals as well, so that we can be creative and adapt to meet their needs. You'll notice another web address in this page. I'd encourage you to pause the video and type this into your web browser and watch this video. It's a great video that's been created by children and young people that pulls together all the strategies that we've talked today in a really catchy song and rap that describes how a child might use all these strategies at school when they're feeling anxious. So that's a whistle-stop tour into thinking about understanding anxiety and how to manage anxiety for your children and young people. I just want to acknowledge that as a parent or carer, it can be really hard supporting a child who's experiencing anxiety. As a result, we've created a range of resources on our Hampshire CAMHS website, including a Hampshire CAMHS Parent Carer Manual, which is there to support you as a parent, to support yourself when you're supporting your child. I'd really encourage you to take a look at our website for further information on this. I wanted to end by introducing to a range of resources that build on a lot of the things that we've talked about today. There are a range of websites, books and apps that can be really useful. In particular, I really like Get Self-Help because it's a really useful app that has a lot of printouts and handouts of some of the CBT strategies we've used that you can use with children to help them think about their own strategies and cycles around anxiety, and then think about how they can change that cycle. There's also 2 really good books that I'd recommend, including Overcoming Your Child's Fears and Worries by Kathy Creswell. It's for under 12s, however I think it's a great resource for all parents, and it describes lots of the strategies, including making a stepladder in further depth, and gives you some strategies around problem solving with your child to help them have a go and challenge anxiety. What to Do When You Worry Too Much is also a great book that describes worries as a tomato plant and how we feed that tomato plant and it grows and grows. And that's a really helpful book for parents when supporting younger children with anxiety. There's also a range of apps that could be really useful too. Self-Help for Anxiety Management by Sam is a really good app for children, and What's Up, the mental health app, is a great app that allows children to keep a thought diary to track their anxious thoughts, and also provides some of the strategies such as 5, 4, 3, 2, 1 and breathing strategies that children can use anywhere in the moment to remind themselves to reduce those physical sensations. Again, there's lots more resources on our Hampshire CAMHS website that are really useful too.